Hello everyone, hope you're all doing well. Thank you once again for joining us today. We have with us Ambassador Sandhu, who's the Ambassador of India to the United States. He has been very kind and has provided leadership and direction to the activities of the India Student Hub. Sir, thank you so much for joining us today and making time. Just so you know, we are joined today by about 350 live viewers. For the first part, we've aggregated about 400 phone questions and 500 peer support calls into categories. They range from travel to passport and visa renewals. The students are eagerly waiting to hear from you.
Hi, can you hear me?
Yes.
Okay. Hi, no, thank you very much. I think this is a opportunity to reach out to a whole lot of students, and I will start by complimenting you and your team for creating this hub, this line through which we can have an exchange and I can reach out to many of your colleagues. I think I'd like to start first by, we are in a extraordinary, unprecedented medical emergency situation. This situation is neither a creation of the students, nor creation of the United States government, nor a creation of Indian government. It came, but all of us have been proactively dealing with it. Right from the start, on 11th, as you are aware, visa restrictions were put in India. We created a 24/7 helpline, and I'm just focusing on the students' issues here. Through your hub, through your platform, also, we were able to get inputs. What exactly are the problems that are coming up? Some students had problems regarding accommodation, so immediately the embassy group got in touch with the university authorities. We tried to sort it out. Many of the students, international students, were able to stay on. Then we also got in touch with some of the hotel owners. Many of them were from the Indian American community. They also came forward, offered places. Some had even food and other supply problems. Those also, people have come forward. Embassy has coordinated, the consulates have coordinated. Some had medical problems, some medical issues. Emergency medical assistance was provided. So it's a developing and an evolving situation. And we are there, all of us together, very much standing shoulder to shoulder. My embassy officials, the consulates, 24/7, they are available. Whenever you require any assistance, tell us. And we try and help out. But we also have to understand the situation in perspective. As I told you, it's a medical emergency. It is evolving, and we have to face it together. And I think the students have the maximum innovativeness. I recall from my own personal experience, school, college, university, all the time I stayed in a hospital. And I think that's where we learn how to face adversity. So, in fact, rather than the embassy giving a helping hand, I would take a lot of lessons from the students. So, we are in it together. In fact, since I'm going back to my student days, I also remember I played hockey. And in a field game, you learn the team spirit. Mm-hmm. That's also very important in this situation. We cannot just be looking at ourselves. We have to look at each other. We have to look at our families, our society, our peers, our friends, and the people around us, their medical welfare, their well-being is also our responsibility. So, therefore, in my opening remarks, I will say, as I said, we are all in it together. We are standing with you. We are not going anywhere. And you look at the facts. Up till so many weeks, all of you have performed so well. And it's your responsibility to see that all your peers stay well. One, that you stay well, you follow all the instructions, those are being given. There are very clear medical instructions which are, and I'm not even saying advisory, now they have become instructions. So, not only you have to see that you obey them, you also have to see that your peers and your family members who are getting worried, that you are able to tell them back that, look, I am fine, but you please take care of yourself. Follow what you are being told. So I look forward to hearing from you. These were some of the opening remarks I wanted to make.
Sure. Of course, Ambassador, and I think you've actually hit the nail straight up, because a lot of questions that students have asked have centered around a lot of the themes that we've just touched, and I'd love to come back to some of them. Just to be able to begin, I believe that one of the most common questions that we've heard are surrounding the travel category, so that's perhaps a good place for us to start. Now, a question that Revati from Savannah College, Mayank at Northeastern, and several others have raised is centered around exactly that: when and how they can travel back to India. At the same time, we've had some students who've noticed that the WHO and other organizations have commended the lockdown efforts that countries like India and Singapore have made. So if you could please speak to the lockdown that India has implemented and its impacts on students.
Okay, I deliberately left out the India part because I thought most of your people are following and we are essentially addressing the students here. But let me take 2-3 minutes. I think it's very important and significant that the Indian leadership has shown complete proactive decision making, and while the numbers are still very low compared to, please keep in mind that we are a country of 1.3 billion people. We are a democratic polity. You can see here itself how difficult it is to impose a lockdown. You know, with the provincial governments, with the mayors, etc., etc. Similarly in India. But in India, the entire political leadership has come behind Prime Minister Modi. They are supporting the lockdown fully. In the first experiment we did what was people's curfew, everybody came on board. Then we went in for a lockdown when the numbers are still low. But that has saved us so far. It also gave us much needed time to establish medical requirements, to establish the number of beds, the hospitals, and one part I would like to bring to all of your attention, which is mostly missed, that we have a very strong public health system which is quite informal. In our villages, our health workers are very, very well conscious about virus and tackling epidemics. So, you don't always need a very structured setup. The rural healthcare system functions very effectively to be able to tackle such emergencies. And we have in the past. And the present numbers also show that this lockdown has ensured that the numbers remain much in control. And as you have been reading. So that part I will say situation is much better, but we have to be very mindful that two of the most important directives that are coming. One is social distancing. Second is avoiding crowds. In a high density places like, for example, New York, you have seen what is happening. Therefore, in India, we have to be very, very careful, and that's why this strong lockdown has come. And this lockdown is not because the authorities wanted it. It is for the goodwill, for the welfare, for the health of all your near and dear ones. And that's why we need to be very, very conscious of it. Now, your second question about travel. I know that a lot of queries have been coming on that. First, let me bring you back on 11th, the first travel restriction started. On 22nd was the last flight. So there was an adequate time given for any emergency plan. But I again want to bring you back to the two essentials. One, social distance. Second, against travel. Therefore, all the students need to keep in mind that for them to undertake an 18-hour journey is inviting trouble. Not only trouble for themselves, but also where they are going. At this time, the most advisable thing to do is to stay where you are. It has carried you so far. But what we are hearing is that the next 2 weeks are very critical. So stay where you are. Once the situation improves and travel